But what I like to do is maximize the time with Dr. Mattson. As I said, she's on the front lines. She's a primary care physician. And most important, I'm so proud that I'm her brother.
Thank you, David, for inviting me. I'm a family physician. I've been practicing in the Seattle area for over 20 years. The Life Care Center out of Snohomish County was the first major outbreak here in King County, or in the United States and in Washington State. We're basically been in the bullseye of the outbreak from the very beginning. So in urgent care, what I do now is just see patients who have COVID-19 or we suspect have COVID-19. My job has completely changed from a little over a month ago when I used to see, people coming in with ankle sprains and lacerations and abdominal pain. We have made some major rapid operational changes from day one. Our very first community spread case was diagnosed that night. The leadership had the wherewithal to essentially pull an all-nighter and decide that everything needed to change. One of the practical issues that I've used was David, what he talks about in his book about the fist to five. Every day we do a morning huddle with my team. What I started to do, ask my staff, how safe do you feel is really the question, or how safe are we? On the very first day I did this, and most of my staff were putting up 4s and even 5s. I mean, I would never be a 5, even if I went to the grocery store. I would say 0 is I don't feel safe, and 5 is we're totally safe. But one medical assistant, she raised her hand. She was a 0. And I said, do you feel comfortable sharing why you're not feeling comfortable? She said, well, my father has cancer and I cannot go and visit him because I'm working at this site. I encouraged her to talk to her supervisor. I ended up calling him directly. And I said, I don't think this is correct. I think if people really don't want to be working the front line, they shouldn't be. And the long and the short of it was that he completely agreed with me. Another one was that I'd made some changes at our own site that I work at of improving safety within our central work area, feeling that we were pretty good in the exam rooms, but when we are all together, we really weren't practicing social distancing. We were likely to get each other sick. I recognized that and instituted a couple changes, keeping all the exam doors closed and spreading us apart within our work pod, and having a separate room that we use for putting our contaminated gear. With that, last week I did a fist to 5, and one of the medical assistants said that she was a 0 or a 1 when she was working at other sites, but she was a 4 at our site. She felt safer in our setting because of what I had done. And the third example was a nurse I worked with on Sunday, and she rated herself a 4, but then she called me in a panic on Tuesday, and she texted me in a panic that the leadership had removed some important protective equipment from our work area. She was almost in tears. She's like, I don't know what I'm supposed to do. How am I supposed to do my job? And turned out that the intent was noble, that our leadership was trying to protect a certain aspect of our gear. In the process, there was a miscommunication, and they removed a second piece of protective gear, which they weren't supposed to. So this left our team feeling essentially naked, protecting themselves against this virus. Because she felt comfortable and safe reaching out to me, I could find the answer that she was more comfortable. I've told leadership, I've said, kind of David's used this phrase, what I see is different from what you see. It's a bit of a bizarre twist because you go into medicine and you think your patients are going to come first and foremost, no matter what. But right now it's important, but what's more important is us personally and our health, because we can't control this virus. We can't control this pandemic. I've told leadership this too. I said, if we run out of gear, if we feel we aren't safe, then I'm going to walk up and close the front door. Where I see it is myself, my team's safety has to come first.